ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ, ਸਵਾਗਤ ਹੈ ਤੁਹਾਡਾ ਸਾਰਿਆਂ ਦਾ ਇਨਫੋਕਸ ਦੇ ਵਿੱਚ। ਮੈਂ ਹਰਪਿੰਦਰ ਕੌਰ। ਬੀਤੇ ਦਿਨੀ ਓਨਟਾਰੀਓ ਮੈਡੀਕਲ ਐਸੋਸੀਏਸ਼ਨ ਦੇ 200 ਤੋਂ ਵੱਧ ਡਾਕਟਰਾਂ ਨੇ ਇੱਕ ਲੈਟਰ ਤੇ ਸਾਈਨ ਕਰਕੇ ਪ੍ਰੋਵਿੰਸ਼ੀਅਲ ਸਰਕਾਰ ਨੂੰ ਗੁਹਾਰ ਲਗਾਈ ਹੈ ਕਿ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮਸ ਤੇ ਕ੍ਰਾਈਸਿਸ ਸੰਬੰਧੀ ਕਦਮ ਚੁੱਕੇ ਜਾਣ। ਕੀ ਹੈ ਪੂਰਾ ਮਾਮਲਾ, ਐਸੇ ਤੇ ਰਹੇਗੀ ਨਜ਼ਰ ਅੱਜ ਇਨਫੋਕਸ ਦੇ ਵਿੱਚ। ਓਨਟਾਰੀਓ ਮੈਡੀਕਲ ਐਸੋਸੀਏਸ਼ਨ ਇੱਕ ਅਜਿਹੀ ਐਸੋਸੀਏਸ਼ਨ ਹੈ ਜੋ ਓਨਟਾਰੀਓ ਦੇ ਲਗਭਗ 43,000 ਡਾਕਟਰਾਂ ਨੂੰ ਰਿਪਰੈਜ਼ੈਂਟ ਕਰਦੀ ਹੈ। ਬੀਤੇ ਦਿਨੀ ਇਸ ਐਸੋਸੀਏਸ਼ਨ ਦੇ ਕਰੀਬ 200 ਡਾਕਟਰਾਂ ਵੱਲੋਂ ਪ੍ਰੋਵਿੰਸ਼ੀਅਲ ਸਰਕਾਰ ਨੂੰ ਲੈਟਰ ਲਿਖੀ ਗਈ ਹੈ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਕ੍ਰਾਈਸਿਸ ਸੰਬੰਧੀ। ਕੀ ਕਹਿਣਾ ਹੈ ਇਸ ਲੈਟਰ ਵਿੱਚ, ਪਾਉਂਦੇ ਹਾਂ ਇੱਕ ਨਜ਼ਰ। ਓਨਟਾਰੀਓ ਦੇ ਮੈਡੀਕਲ ਐਸੋਸੀਏਸ਼ਨ ਦੇ ਡਾਕਟਰਾਂ ਨੇ ਇੱਕ ਲੈਟਰ ਰਾਹੀਂ ਪ੍ਰੀਮੀਅਰ ਡਗ ਫੋਰਡ ਨੂੰ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਦੇ ਕ੍ਰਾਈਸਿਸ ਸਿਚੁਏਸ਼ਨ ਤੇ ਰਿਐਕਟ ਕਰਨ ਦੀ ਗੁਹਾਰ ਲਗਾਈ ਹੈ। ਜ਼ਿਕਰਯੋਗ ਹੈ ਕਿ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮਸ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੀ ਸੈਕਿੰਡ ਵੇਵ ਦੌਰਾਨ ਕਰੀਬ 1500 ਲੋਕਾਂ ਦੀ ਮੌਤ ਹੋ ਚੁੱਕੀ ਹੈ। ਇਸ ਲੈਟਰ ਵਿੱਚ ਪ੍ਰੋਫਿਟ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮਸ ਨੂੰ ਖਤਮ ਕਰਨ, ਜ਼ਿਆਦਾ ਕੁਆਲੀਫਾਈਡ ਸਟਾਫ ਹਾਇਰ ਕਰਨ, ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮ ਦੇ ਫਰੰਟਲਾਈਨ ਸਟਾਫ ਲਈ ਮਿਨੀਮਮ ਪੇ ਸਟੈਂਡਰਡ ਸੈੱਟ ਕਰਨ, 70% ਤੋਂ ਵੱਧ ਸਟਾਫ ਨੂੰ ਫੁੱਲ ਟਾਈਮ ਕਰਨਾ, ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮ ਵਿੱਚ ਐਸੈਂਸ਼ੀਅਲ ਕੇਅਰ ਗਿਵਰ ਲਈ PPE ਦੇ ਨਾਲ ਅਨਰੈਸਟ੍ਰਿਕਟਿਡ ਐਂਟਰੀ, ਹਸਪੀਟਲਸ ਤੇ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮਸ ਵਿੱਚ ਪਾਰਟਨਰਸ਼ਿਪ ਐਸਟੈਬਲਿਸ਼ ਕਰਨਾ, ਹਸਪੀਟਲ ਟੀਮਸ ਨੂੰ ਸਟੈਂਡ ਬਾਈ ਰੱਖਣਾ, ਲੋੜ ਪੈਣ ਤੇ ਮਿਲਟਰੀ ਨੂੰ ਬੁਲਾਉਣਾ ਤੇ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮਸ ਵਿੱਚ ਵੈਕੇਸ਼ਨ ਨੂੰ ਵਧਾਉਣ ਤੇ ਜ਼ੋਰ ਦਿੱਤਾ ਗਿਆ ਹੈ। ਤੇ ਇਸ ਪੂਰੇ ਮੁੱਦੇ ਸੰਬੰਧੀ ਅਸੀਂ ਖਾਸ ਤੌਰ ਤੇ ਗੱਲਬਾਤ ਕੀਤੀ ਓਨਟਾਰੀਓ ਮੈਡੀਕਲ ਐਸੋਸੀਏਸ਼ਨ ਦੀ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਤੇ ਸਪੋਕਸਪਰਸਨ ਡਾਕਟਰ ਸਮੈਂਥਾ ਹਿਲ ਦੇ ਨਾਲ।
Thank you so much, Dr. Samantha Hill, for taking out time for PTC.
A pleasure. Thank you for having me.
Doctor, as we know that around 250 doctors, they have signed a letter calling the Ontario government to look into the crisis of long-term care homes. We'll definitely talk about this. But first, I would like to know, as Ontario Medical Association represents more than 43,000 doctors, how would you describe the situation at long-term care homes?
The easiest way to describe the situation at long-term care homes is unacceptable. It's frankly inhumane what some of the residents in long-term care homes are living through, and many of them are not surviving, as we well know. Now, we know that people who are in long-term care homes don't have the same lifespans as people who are out of long-term care homes, but that's no reason for people to be left in their own filth. It's no reason for people to not have access to food or to clothing changes or diaper changes if they need it. These are our elderly, these are our most vulnerable, these are people deserving of respect and care, and we need to do better to protect them.
But Doctor, as we have been hearing this for more than a year now, even when the members of Canadian Armed Forces, they came for help, they released a report which was disturbing. And even after 1 year of the pandemic, we are still calling for help.
Absolutely. And ultimately, I do it to us physicians to take care of it. We've heard many physicians speak out against what is happening in long-term care homes and what is happening in the care of those residents and those patients. We've heard people decry the living conditions and call frantically amongst neighbors and friends for access to more physicians to come in and take care of them. But at the end of the day, we also know that it's not just physicians who are needed in these long-term care homes. Having 25 physicians wouldn't help if there was no one there to give them medications, to help them have their baths, to get them dressed. We need a whole team of people who can move in and out of these long-term care homes as they're needed. We don't have that at the moment. We also need to better protect these long-term care homes before they wind up in outbreaks, so the people living in those long-term care homes can be safe.
We all know that the situation in long-term care home, it's disturbing. But if we talk about that letter, which is signed by the doctors calling for the government to look into the crisis of long-term care homes, what does that letter exactly states?
So that letter wasn't written by the Ontario Medical Association, and I can't comment on it specifically. My general understanding of the letter is that they are calling for removal of all profit long-term care homes and moving everything into a non-for-profit sector. As the Ontario Medical Association and as the president, we haven't done an analysis of that. We can't speak to that at length, but what we can say is that the current situation is untenable, it's unacceptable, it has been going on for too long, it was predictable, and we need to do better. We need to put into place actions and protections that will protect those residents, not just from COVID-19 and not just from the next pandemic, but from all of the slights and burdens that they've had to carry over the years.
But after this letter, a question was raised to the health minister, Elliott, and she said they have the system in place for all this. They have the system in place to support the long-term care homes. Do you think the government is listening?
Well, rather than asking me if the government's listening, I would ask the residents dying at the Roberta Barry house if they think the government is listening.
One of the objectives outlined in the group was to bring the military assist in long-term care homes. But Minister said the military is not needed.
So I think that's challenging because between on the ground, what's happening, the reports that are created, the reports that are read, and the reports that are pushed up the chain, there's obviously going to be loss of detail and loss of information. And I'll never speak to anyone's intent. I think that COVID-19 has challenged everyone, government included, in ways that were unexpected and that we don't necessarily have the resources for. And we're all trying our best to move things forward. What I think is missing in long-term care homes is a real respect for what the individuals who are living and working in those sites are saying. That for some reason, the message doesn't seem to carry through. And I've heard from members who have gone into some of these long-term care homes, who have called me crying about the things that they've seen that they would never have expected to see in a first world country. And to me, that means there's a problem. Now, is the solution to that problem the armed forces? I don't know. Maybe the Red Cross could be the solution. Maybe there are other solutions. There's usually more than one way to fix a problem. But what I do know is that what we're doing currently isn't enough.
Definitely what is being done currently is not enough. But as you mentioned about to end private and profitable long-term care homes, could that possibly happen?
Anything can happen. Would that solve the problem? I don't know. I think the things that we can do right now that would solve the problem today and tomorrow, as opposed to something that's 2 to 3 years down the line, is looking at introducing rapid antigen screening at every long-term care home so that we can rapidly capture, identify, and isolate cases so there aren't the same outbreaks. And the other thing that we've been calling for a very long time is paid sick day for workers. It is completely unconscionable that someone who works as a PSW, for example, might have to make the decision between going in when they're feeling a little bit unwell or losing their job and not being able to pay rent or food for their family. Those aren't choices we can ask people to make.
ਤੇ ਓਨਟਾਰੀਓ ਮੈਡੀਕਲ ਐਸੋਸੀਏਸ਼ਨ ਦੀ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਤੇ ਸਪੋਕਸਪਰਸਨ ਡਾਕਟਰ ਸਮੈਂਥਾ ਹਿਲ ਦੇ ਨਾਲ ਰਹੇਗੀ ਇਹ ਗੱਲਬਾਤ ਜਾਰੀ ਛੋਟੇ ਜਿਹੇ ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ।
Definitely, paid sick days is an important issue this time because all the advocates of the community and opposition leaders, they are also raising this issue. But if we look at the present situation, Minister said there is now an association between the hospitals and long-term care homes. Do you think our hospitals have the resources to deal with this crisis?
It's another great question. So hospitals do not have unlimited resources either. Hospitals will certainly do their best, but you also have to realize that the lens of a hospital and the lens of a long-term care are very different. Long-term care homes are about making people comfortable and finding ways for them to live out the remaining days of their lives and being in an environment that feels like home. And that's a large part of what happens at a long-term care house. Hospitals are about acute treatment of acute diseases and rapidly turning people over and getting them back out to where they came from or to their next step. And so I think when hospitals come in to help with outbreaks, they have a different lens than some of the physicians that work on site do. And they also have different resources than we might expect, especially currently, especially right now, when we know that many hospitals in some of the harder hit areas are already overwhelmed. We can talk about Scarborough and how I don't think the Scarborough hospitals have anything left to give, no matter how much they might want to. And there are lots of places like that. So the medical community, whether you're a doctor, a nurse, a PSW, a pharmacist, we'll all work together. That we all have the same goals right now, which is taking care of the people of Ontario. And we will cooperate with each other and try to help each other as much as we can. But at the end of the day, there's only so many of us. And what we need is help from the government to put into place barriers that stop the outbreaks and to allow us to respond more rapidly and more effectively when there is an outbreak.
Do you have you recommended some of the steps that can be taken by the government? Like if the process is more simplified and red tape is reduced, that then more time would be given to the long-term care residents?
Absolutely. That's one of the recommendations that we called for, in addition to having a chief medical officer for all of the long-term cares, was to reduce the red tape to get physicians into these sites. And that would enable physicians who were willing to volunteer, who had the skill set, to come from areas that may be less hard hit to help out harder hit areas. We know that physicians are willing. Every time there's been an outbreak and a call, we've had enough physicians say yes, they'll put up their hands, they'll come forth. But when it takes a week or 10 days to get someone into a house that needs help, that's a really long time to wait.
But now, as the province is giving timeline to vaccinate staff and residents in long-term care home by February 5, when can we expect COVID numbers to go down in long-term care homes?
It's a great question, and we shall see. Hopefully, once everyone at the long-term care homes are vaccinated, we'll see an acute drop in numbers. The problem, of course, being that supply is currently a big issue. We don't know when the next doses are coming, so we're prioritizing, or the government has prioritized, that all of the doses go to long-term care residents, but that doesn't mean every long-term care resident will actually get the vaccine. They may not be interested in getting it, they may refuse it, or there may not be enough for each and every resident as we go through the system. Furthermore, we know that the vaccine will reduce your likelihood, and it is very effective, more effective than the flu vaccine even, but it's not 100% effective. So we know that some patients and some residents will continue to get sick, and the rate at which that happens will, in a very large degree, depend on what we call the population prevalence. And so that's the number of people just out in general population carrying the virus, maybe not even knowing it.
As you mentioned, they may not be interested. So how would you address this challenge of vaccine hesitant?
Well, that's not a 1-minute question, but the answer, if I was going to give you a 1-minute answer, is about respecting people's autonomy, asking why they're not interested in getting it, trying to address what the root concerns are. There's a lot of misinformation out there, people who believe it's not safe, people who believe that it's not going to be effective, and we have medical and scientific answers to all of that. It is safe and it is effective. But there are also other reasons that people might not be willing to get the vaccine. Oftentimes it's a question of convenience. It's too far away, it will cost them too much financially and in time to go get it. For those patients and for those people, we need to make it easier. We need to bring the vaccines to local sites. There's also the issue of cultural mistrust that may exist in certain communities which have previously had bad experiences in this lifetime with the medical community. There have been horror stories amongst our Indigenous populations, amongst our Black populations, of being maltreated and mistreated by medical systems. And so when you're trying to tackle that, that's a much bigger conversation. That's a conversation that needs not just words, but those communities are going to need to see action taken to reduce the systemic inequities that they see day in and day out in order to be able to start trusting the system and start following the same path. Until we see that, the best we can do is involve members of their community. As you might have heard, there's a common sentence, nothing about us without us. And so that means that if I want to engage with the Indigenous population, I need to involve the Indigenous population in that conversation. It can't be about putting North American standards onto someone else's culture.
Any other recommendations from what we have already discussed?
I think the last recommendation that I would want to make, which is really quite important, is going back to the very basic guidelines. Even as the new variants come in and even as they scare us with increased virulence and increased rapidity of spread, we know that the same things that have always worked will continue to work. And that, of course, is hand washing, masking, and 6-foot distancing. So the more we enable that, the more we enable our public health to do contact tracing and isolating, the better we will do as Ontarians.
If I look at long-term care, what steps do you suggest can be taken immediately to improve the situation and help ease the crisis?
So the most immediate and easy step would be to introduce the rapid antigen testing. That would be the first thing that we can do, which would really allow us to identify and then isolate cases much more rapidly, which would reduce the risk of outbreak. The second thing really is about those paid sick days, making sure that we don't have employees coming to work carrying the virus in. The third thing, of course, would be about virtual care, enabling and empowering physicians to provide that care virtually so that a physician who may be taking care of more than one long-term care house can continue to provide care to all of their patients without carrying the risk of virus from one house to the other. And then finally, the biggest interference, the biggest thing that could be fixed today is about that red tape and making it easier for physicians to help each other in different places.
Well, Dr. Samantha Hill, thank you so much for taking out your time and discussing this important topic with us. We hope the government listen to you and step up to end the crisis in long-term care homes. Thank you so much and stay safe.
Thank you. Stay safe.
ਸੋ ਐਸੀ ਖਾਸ ਗੱਲਬਾਤ ਓਨਟਾਰੀਓ ਮੈਡੀਕਲ ਐਸੋਸੀਏਸ਼ਨ ਦੀ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਤੇ ਸਪੋਕਸਪਰਸਨ ਡਾਕਟਰ ਸਮੈਂਥਾ ਹਿਲ ਦੇ ਨਾਲ। ਇਸੇ ਮੁੱਦੇ ਨੂੰ ਲੈ ਕੇ ਅਸੀਂ ਪ੍ਰੀਮੀਅਰ ਡਗ ਫੋਰਡ ਨੂੰ ਵੀ ਸਵਾਲ ਕੀਤਾ। ਕੀ ਕਹਿਣਾ ਹੈ ਪ੍ਰੋਵਿੰਸ਼ੀਅਲ ਸਰਕਾਰ ਦਾ, ਆਓ ਜਾਣਦੇ ਹਾਂ। ਪ੍ਰੀਮੀਅਰ ਫੋਰਡ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਸਰਕਾਰ ਇਹ ਸੁਨਿਸ਼ਚਿਤ ਕਰਨ ਲਈ ਵਚਨਬੱਧ ਹੈ ਕਿ ਸਾਰੇ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮਸ ਦਾ ਹਸਪਤਾਲਾਂ ਨਾਲ ਭਾਈਵਾਲ ਰਹੇ ਤਾਂ ਜੋ ਆਊਟਬ੍ਰੇਕ ਹੋਣ ਤੇ ਇਸ ਨੂੰ ਜਲਦ ਤੋਂ ਜਲਦ ਰੋਕਿਆ ਜਾ ਸਕੇ। ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਮਿਨਿਸਟਰੀ ਸਿੱਧੇ ਤੌਰ ਤੇ ਪਬਲਿਕ ਹੈਲਥ ਯੂਨਿਟ, ਲੋਕਲ ਹੈਲਥ ਇੰਟੀਗ੍ਰੇਸ਼ਨ ਨੈਟਵਰਕ ਤੇ ਸਾਰੇ ਹੈਲਥ ਸੈਕਟਰ ਪਾਰਟਨਰ ਨਾਲ ਕੰਮ ਕਰ ਰਹੀ ਹੈ ਤਾਂ ਜੋ ਇਹ ਯਕੀਨੀ ਬਣਾਇਆ ਜਾ ਸਕੇ ਕਿ ਜਲਦ ਤੋਂ ਜਲਦ ਆਪਰੇਸ਼ਨਸ ਨੂੰ ਨਾਰਮਲ ਕੀਤਾ ਜਾ ਸਕੇ। ਮਿਨਿਸਟਰੀ ਵੱਲੋਂ ਪਾਰਟਨਰਸ ਨਾਲ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮਸ ਵਿੱਚ ਪ੍ਰੀਵੈਂਸ਼ਨ ਕੰਟਰੋਲ ਤੇ PPE ਦੀ ਐਡਿਕੁਏਟ ਸਪਲਾਈ ਲਈ ਕੰਮ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ ਤੇ ਹਰ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮ ਵਿੱਚ PPE ਤੇ ਐਮਰਜੈਂਸੀ ਟਾਪ-ਅਪਸ ਲਈ 8 ਹਫ਼ਤਿਆਂ ਦਾ ਐਕਸੈਸ ਹੈ।
Well, that's primarily because we have now an association between hospitals and long-term care homes, and hospitals are standing forward and helping the long-term care homes that are having problems, both in terms of supplying staff as well as supplying PPE and whatever else they need. In certain circumstances, the Red Cross has also been involved. If we need to ask for the Armed Forces assistance, we will do so. But right now we have a system in place where the hospitals are supporting those long-term care homes.
ਸੋ ਹੁਣ ਤੱਕ ਲਈ ਇਨਫੋਕਸ ਵਿੱਚ ਬਸ ਇੰਨਾ ਹੀ। ਫਿਲਹਾਲ ਮੈਨੂੰ ਦਿਓ ਇਜਾਜ਼ਤ। ਤੁਸੀਂ ਰੱਖੋ ਆਪਣਾ ਖਿਆਲ ਤੇ ਦੇਸ਼ ਦੁਨੀਆ ਦੀਆਂ ਖਬਰਾਂ ਲਈ ਬਣੇ ਰਹੋ PTC ਦੇ ਨਾਲ।